I'm excited.
Welcome to Now Hear This. I'm your host, Chris Spangle. Now Hear This is a conversation with leaders in Indianapolis that are working to improve the lives of Hoosiers. Our goal is to empower you to join in their work and make a difference while informing you about the unseen aspects of life in Indiana. If you miss an episode, you can listen via podcast at nowhearthisindy.com. Today I'm talking with one of my good friends, a former co-worker at the Bob and Tom Show, where we briefly worked together, Eric Todderud, who is a business development associate at Fairbanks, which is a recovery center. Eric, thank you so much for joining me.
Thank you for having me, Chris.
So you can find out more information about them at fairbankscd.org. But Eric, tell us, what is Fairbanks, what do you do, and what is your job there?
Yeah, so Fairbanks is an addiction treatment facility. We're on the northeast side of Indianapolis. So if anyone's familiar with the Castleton area or Community North, we are right next to Community North. Actually, this year, 2020, we're celebrating 75 years. So we're one of the oldest addiction treatment centers in the country. And we offer a full continuum service for addiction treatment, meaning everything from acute detox through residential, various outpatient levels of care down the line. Basically, if you can think of a level of treatment for substance use disorder, very good chance that we offer something like that for both adults and adolescents.
Are you comfortable sharing your story? Are you willing to talk about that? Tell us a little bit about your journey and why Fairbanks means so much to you.
Yeah, absolutely. So I'm actually a person in long-term recovery. So I've been sober for about 5.5 years now. And yeah, when I was about 22, I found myself over at Laverna Lodge for men. That's the residential program up in Carmel that we have. It holds 14 men. I found myself up there after making some questionable decisions that landed me, with some depression and substance use issues. Stayed there for 4 months. Got kind of connected with the recovery community through that program, and then left and went into sober living. Lived there and basically haven't looked back. Been sober a day at a time since that day. So it's something that is kind of near and dear to my heart. And if I think the big thing is if I can do it at the age of 22 and as in the mindset that I was in, I believe that these programs can help anybody.
Yeah, and so your job there is what? Do you work with people who are going into the treatment program? Tell us a little bit about what you personally do at Fairbanks.
Yeah. So I work with a bunch of different, providers, medical providers, behavioral health providers, Department of Child Services, probation, some employers. We work with a lot of employers. I don't do as much with the employers, but we have people that do more with the employers. And I'm trying to think some attorneys, pretty much anybody who would come in contact with somebody who's struggling with substance use disorder, and needs help. I reach out to them, make sure that they're aware of what programs we do offer, criteria, and how to access these services. I kind of create a point of contact, and I'm kind of a liaison for those folks that that come in contact with people who need help.
So in your work and in the Fairbanks organization, obviously with the pandemic, I've heard anecdotal evidence that people are struggling and having a harder time. I mean, I think all of us are struggling with some level of grief, and some people are experiencing trauma at worse levels, the economy and job loss. These are very difficult things to deal with. Everybody has a lot of feelings around a lot of things. And maybe you can speak from your own personal experience, but I wonder, what are you hearing from people who are going through the program in this time of being quarantined and locked up in your house and this just extra pressure?
Yeah, absolutely. So, first off, isolation is a huge part of addiction and substance use disorder. Oftentimes, so if you talk about relapse, you're talking about not just the actual use of that substance is kind of the endpoint. People think of that as being the relapse, but the relapse actually starts a lot earlier, so way before that actual use. And isolation is oftentimes the first thing that people first indicator towards a relapse. So it is a concern. But there's definitely resources. I think a big thing for me is my heart goes out to the newcomer right now. So for me, as when you reached out to me, Chris, I started thinking, oh, this is super easy. I got all these people. I get texts multiple times a day about meetings that we're doing or whatever. But that's after 5.5 years of being connected to a recovery community. The big thing, the difficult thing I think would be to be a newcomer right now coming in. And what I've heard from and this is, anecdotally, this is just what I hear from people, is how hard it is to feel really connected to the community through, especially getting connected to the community, starting off through virtual meetings.
So what are some of the ways that some of those, let's start with maybe some questions that a person may ask themselves to discover if they need to seek resources. Like, what are some signs? Because in all my experience with friends and family that have gone through substance abuse issues, or they're drinking too much, or they're using drugs, or things are getting out of control, it seems gradual. It's not, it's not that big moment. It's, wow, I've had this behavior this many times. Maybe I have an issue. What are some warning signs that our audience may apply to themselves or the person in their household or family member in this moment that could kind of help them go, maybe I ought to talk to somebody?
Yeah, so I think that the big thing is using in the face of consequences. It can be something gradual. It can also be, you start noticing that a family member or a loved one is distancing themselves emotionally from the family. I mean, it can be something that small, or I guess it's not small, but something that subtle. It doesn't have to be a DUI or consequences in that way. But a big thing is when somebody starts experiencing consequences and continues to use in the face of those consequences, that's kind of when I would say you start looking at it as a problem and maybe talk about reaching out for some services.
Is there what are some other warning signs? Just not just the distance, but some other behaviors that may be problematic. So,
of course, if they're using, if they're waking up and using, if somebody is experiencing, like signs of detox, if they have to use or drink, basically in order not to get sick, that's a big sign. That's a huge sign. And that's a big thing with opioids, alcohol, benzodiazepines, some of those substances, is using in to the extent where when you stop using, you are you're getting sick. That's when somebody needs, medical detox. And that's a big one. I think that, other ones, I mean, if a family member is drinking throughout the day, that's something I think to look at. I mean, I don't want to say everybody that has a drink, on a Saturday at noon is an alcoholic. That's not what I'm saying. But if it's something where you're noticing that this person is choosing to drink, or really not choosing, once it's, addiction is not really a choice. Once you're an addict, it's not really a choice anymore. But if somebody's drinking throughout the day, or waking up and using, I think that those are huge signals. And with the emotional distance, I was kind of getting it. If they're hiding their use, if they are hiding their use, then you'll notice them being, generally a little bit emotionally distant from.
So I think that those are great kind of tip-offs. And how do you have that conversation with a loved one that maybe they're having a problem? Because that doesn't always seem to be an easy conversation.
Mm-hmm. Yeah, I think a big thing is, starting off, I think before even just approaching the person and, kind of being almost accusatory at that person, I think it's a good idea to reach out to other people who have experienced family members who have used who have struggled with substance use disorder. There's family support groups, and I think that number one, a family needs to start before they even expect their family member to really get the help and change. I think that they need to look at some of the support for themselves, and then look at their family member as well. Some of those support groups, I know Overdose Lifeline right now has family support groups for free going on. And then approaching the person, I think, it's partly it depends on each individual, but approaching that person and, not being accusatory, not saying, hey, you're ruining my life and you're doing,
right.
I think
not being passive aggressive about it, just being honest.
Yeah. Approach them in an honest way. Say, hey, look, this is how this is affecting me. And this is how it's affecting the whole family. Would you be open to maybe getting an assessment? Fairbanks, we offer free assessments. It's free to pick up the phone and give us a call. And the good thing is that once you pick up the phone and give us a call, there's professionals on the other end of the phone who can kind of take some of the information that the family member is giving us, then take the information that the person struggling with substance use disorder is giving us, and then we can recommend a level of care based on the actual information. And these are people who, when we're answering the phone, we understand that there's going to be probably two different, we're going to get information from two different people, and we're going to kind of dig a little bit deeper than just taking the family member's word and then taking the other person's word always,
Right.
It's a little bit more complicated than that a lot of times. So I think it's always a good idea to pick up the phone and give a professional a call.
Okay, so if you want to reach out, then their phone number is 1-800-225-4673. Again, that is 1-800-225-4673, or you can go to their website, fairbankscd.org. My guest is Eric Todderud, who is a business development associate at Fairbanks. In our final question here, what is the thing that you see on a daily basis that you wish people understood about the community that you serve?
Something that I see on a daily basis, something I see on a daily basis that I want people to understand about people with substance use disorder is that they're not always the homeless person living under the bridge who has a bottle in a brown paper bag. This is a population. These are our friends and family members, who may be struggling. I think that all too often I meet with people and I meet with professionals who, I know that they have, that they're coming in contact with people that are struggling with substance use disorder. And I hate when I meet with somebody and they say, oh, we don't even see that population here. It's, really we only see people, kind of white collar people who are, it's like, that's not accurate. This disease does not discriminate. It's like, it's almost as, it adversely does affect certain populations, but, really the person that's struggling could be, the person next door, or a friend or family member who, isn't necessary, who has a good education, has, maybe even still has their job and, still, is struggling. And I think that something that's, going to be interesting is seeing as we move past this, the amount of people who, have been isolated, who are going to be probably using and drinking throughout the day. They're working from home, or they're, not coming in contact with their employers or their family members. And I think that we're going to see a spike in people. I think that, like Fairbanks, for example, I think we are going to see a spike in people who are going to be coming through our doors looking for help once they get back out and their employer or their family members start seeing them again and start seeing that, hey, they've been, they've been using, they've been drinking while they've been at home. I think that's something, and that's just my personal opinion about that.
Well, I hope that if people feel that they have an issue, or if they feel a loved one has an issue, that they do go to fairbankscd.org and get some help. And it's better to the guardrails are off a little bit on a lot of different issues, and obviously this is one place to go to help get better. So, Eric, thank you so much for joining.
We have those.
Go ahead.
We have those virtual. Just real quick, we have the virtual online IOP, which is like a virtual group that people don't even have to come in to get assessed. They can give us a call and do it all over the phone. So if you're worried about getting about the pandemic, and it's something that I know, even though I said, people anecdotally don't feel like they connect as much via, virtual groups, it's a lot better than doing nothing,
or being alone
and being at home. Yeah. Being at home alone and not reaching out. So I know we're wrapping up. I just wanted to kind of plug that real quick because I know that it's something that could help a lot of people. And then there's free virtual peer-to-peer groups that are put on by the Indiana Addiction Issues Coalition. I can send you any of that information, Chris, and if any of your listeners are more interested, they can always reach out to me as well. I have a long list of free and free resources for people, and then also resources within Fairbanks that are really helpful. So any of your listeners can always feel free to reach out to me, or I can send it over to you. So whatever you want to do with it.
Yeah, we can put that in the show notes so people can go to nowhearthisindy.com and look for this episode and then find that there, along with a link to fairbankscd.org and the phone number. Eric, thank you so much for joining me.
Thank you, Chris. I appreciate you having me on. Absolutely.
Thank you for listening to Now Hear This. I'm your host, Chris Spangle. If you missed any portion of our program, again, you can go to nowhearthisindy.com and find it there. If you'd like to have your organization featured on the show, please contact Gabby at 317-475-7407 or via the contact page on our website. Thank you for listening, and we will be back again soon next weekend with Now Hear This. Our goal at the Chris Spangle Show is to help you sound smarter while talking with your friends. If you struggle to understand politics, we explain it from an independent libertarian perspective with all of the irreverence modern politics deserves. We toss out the screaming heads and put people before political parties and give context to the news to make you think. I'm the host. I'm a 15-year veteran of politics and media, and this show is published every Saturday. It's part of the We Are Libertarians network, and be sure to join Wall Plus for bonus podcasts, the complete archives, commercial-free shows, and more. Subscribe now at wearelibertarians.com.